What is known about mucormycosis? Mucormycosis is a family of diseases caused by mucormycetes, a common class of fungi typically found in soil or decaying organic matter. This disease used to be called zygomycosis. Mucormycosis cannot be directly transmitted between people or animals, so only those who have been exposed to mucormycetes in their environment can be infected. After mucormycetes mold spores enter or colonize the body, if host conditions are favorable, they can sometimes spread into the surrounding tissue and vascular system, rapidly causing necrosis and systemic infection. Mucormycetes can cause many types of infections, including rhino-cerebral, pulmonary, and cutaneous and soft tissue infections. How does mucormycosis present? Like most fungal infections, mucormycosis resembles a bacterial infection in the initial presentation. But fungal lesions will often progress since they will not respond to antibacterial or antiviral medications. The most common type of mucormycosis is rhino-cerebral, which presents initially as a persistent sinus infection. More severe progression will present with facial swelling and bloody nasal discharge. In the pulmonary form, patients will often initially have nonspecific symptoms such as fever, cough, chest pain, and dyspnea. The clinical presentation may be similar to other causes of pneumonia. Cutaneous mucormycosis can appear similar to bacterial causes of skin infection at first, with tenderness, erythema, and fluid drainage from the infection site. As the infection progresses, patients can develop blisters or ulcers as well as black necrotic lesions. A fungal infection, including mucormycosis, should be considered if a patient has a persistent infection that is not responding to initial treatment. Methods for diagnosing fungal infections vary, but they are usually diagnosed in a laboratory through histopathology or fungal culture. It is important to order a fungal culture in these cases. How and when should mucormycosis be treated? Fungal infections like mucormycosis can have mortality rates higher than 50% if they are not treated quickly and correctly. Mucormycosis should be treated with antifungal medications, and surgery is often necessary to resect and debride infected and necrotic tissue. Importantly, early diagnosis and initiation of treatment may lead to better outcomes. Therefore, maintaining clinical suspicion for these infections is very important.